for joining today's virtual education program with Cancer Support Community Los Angeles. I'm Larissa Montalvo, the program manager here at CSCLA, and I welcome you to this week's webinar titled Cancer and Chinese Medicine During COVID. In a few minutes, we will be joined by Dr. Lucy Postolov to discuss the Chinese view on supporting patients with cancer using acupuncture, herbs, self-massage, support of the immune system, diet, anxiety control, and more, all in the time of COVID-19. But before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch our past webinars, please visit our website at www.cancersupportla.org. I would love to introduce today's speaker. Dr. Lucy Postolov is a licensed acupuncturist and herbologist, board certified in integrative medicine. She received her second doctorate in acupuncture and Chinese medicine in 2019 and has been recognized by the Israel Cancer Research Fund for her work with oncology patients. Dr. Postolov has authored chapters in 3 published books, the latest being Cambridge University Press's Handbook of Wellness Medicine, published in 2020. She also proudly represents her specialty on the Professional Advisory Board at Cancer Support Community Los Angeles, for which we are so grateful. Without further ado, I welcome Dr. Lucy Postolov. Thank you so much for joining us today, Dr. Postolov. The floor is all yours.
Thank you so much, Larissa, for such a wonderful introduction. I also want to thank all participants in today's seminar, and it's my pleasure and honor to learn that already 85% of people heard me before. Before the COVID, I would speak on a regular basis, presenting in wellness community 2 to 3 times a year. Right now, it's a little bit more difficult because I am a person who really likes a personal contact. I like to look in your eyes and see your reaction and answer your live questions. But considering the time of COVID, we're doing the best we can. So again, everybody, thank you so much for having an interest in this subject. I want again to thank Larissa, Shannon, and Julia for making this seminar happening. Normally, when we start presenting anything, we are doing small disclosure, telling that we're not selling anything, we are not promoting anything, that it's only educational. But I have to let you know that I am heavily invested in this subject for personal reasons. My mom passed away at the age of 62 when I was in my 30s, and my grandma passed away at the age of 35 when my mom was only 3 months old. And to make matters worse, my husband of 33 years passed away from lung cancer after very happy marriage of 33 years, and it was about 9.5 years ago. So all my life is really dedicated to helping cancer patients to go through their difficult journey. How did I get into Chinese medicine? A lot of people ask me this question because most of you probably know that I started my career as a Western medical doctor, and I did my specialty in neurology. And during one of my grand rounds, I was presenting to the professor about the patient of mine who I totally could not help for 3 weeks with the pain. And we were very lucky because from the part of Russia where I am coming from and medical school I graduated from, we had doctors from Tibet. And one of the doctors suggested for me to help my patients who I tried to treat for 3 weeks in the hospital without any success, without any results. And we did everything from opioid treatment to epidural blocks to physical therapy, spine extension, etc. And the doctor from Tibet, in 30 minutes, put the needles in my patient, told me to come back. And when I came back, he pulled out the needles, and my patient, who for 3 weeks was in bed without movement, in excruciating pain, walked around the room, gave me a dirty look, and told me, "That is how you should treat me, doctor." So my ego at the age of 24 was completely crushed. And at that point, I decided that I want another specialty in Chinese medicine. And that's how my career of integrative medicine, blending Eastern and Western medicine and doing both started. For 7 years, I was working in a major hospital in Russia doing both Chinese medicine and Western medicine. It is allowed for MDs to do acupuncture in the hospital in Russia. And later, when I came to the United States, I was the first acupuncturist who brought acupuncture to Cedars-Sinai Medical Center. It was 25 years ago. So that is very short, or maybe too long, history about myself. Now I want to talk about what is integrative medicine and what it is, how is integrative medicine blends the complementary medicine and mainstream medicine. So we all know that mainstream medicine is only about 200 years old, and it is your chemotherapy, it is your radiation, it's immunotherapy, and complementary and alternative medicine is a very wide variety of other medicines. If you're going to look at this chart, you're going to see that for 3,000 years, we had mostly, actually almost 5,000 years, we had what is now called complementary and alternative medicine. And only in the last 200 years, we start having what American Medical Association is calling Western medicine. And I want to stress here that although it's considered a new medicine, Chinese medicine once suddenly became popular in the United States only about 60, 70 years ago. But this is really a medicine which is over 5,000 years old. Now, there is a new field which is now called integrative oncology. And basically, integrative oncology is intersection of cancer treatments the way we know it now, with oncological research, with integrative medicine. And that will include acupuncture, Chinese herbs, meditation, yoga, and dietary supplements. Now, I want to stress here that I personally never treat my patients only with Chinese medicine. I'm going to share with you a case when a patient with colon cancer in a stage 1 or 2 came to me, and he told me that he doesn't want to have surgery. He doesn't want to have chemo radiation. He wants to be treated only with Chinese medicine. And my answer was absolutely not. I'm not taking patients. So for all of you who want to know. I don't take patients who don't have a primary oncologist. And if they don't have it, I'm providing them with a list of oncologists, surgeons, hematology oncology, radiation doctors. I never believed that acupuncture or Chinese medicine is strong enough to conquer cancer. And that is my personal belief. So if anybody gonna tell you, I'm gonna just treat you with Chinese medicine, run away. As a matter of fact, I refused to take that patient, and his wife wrote me a very mean letter. And 4 months later, he came to me with stage 4. He did try somebody else who told him that they can cure his cancer just with Chinese medicine. And unfortunately, by the time he visited one of the doctors I gave him on my list of oncologists, and I work with many doctors all over the city. I'm in Los Angeles. He was in stage 4. Now, the picture of integrative medicine and cancer patients is changing. When I started 25 years ago, I was a very, very rare species, because a lot of people, when I would come to hospital, to Cedars-Sinai, would not even know how to find me on the internet, how to find me, how to enter the charts in computer, because it was not that many of us around. And up to these days, there are only 6 acupuncturists in Cedars-Sinai. So in 25 years, they got only 6 doctors on staff. However, there are a bigger and bigger demand for cancer patients to be seen by acupuncturists. And if you look at these numbers, you can see how in 1970, it was only 25% of patients who would use complementary and alternative medicine. And in our days, there are between 80 to 99% of the patients who are using integrative medicine. And why do you think it's happening? Why people, because sometimes it's not covered by insurance. Why do people try to do integrative medicine? Why do they try to do complementary medicine and pay out of their pockets? The reason for that is that they see a huge difference when they're using complementary and alternative medicine on the top of the, what we call right now, regular medicine. Now, this slide might look a little bit strange for you, because normally when I present my lectures, I do not operate with Chinese terms, because Chinese terms, we're talking about yin and yang, we're talking about qi or energy flowing in the body, we're talking about stagnation of that energy or depletion of this energy. But I want just you to understand a little bit of philosophy of Chinese medicine, because I think even if it sounds a little bit primitive, it has a lot of wisdom. So in Chinese medicine, we do believe that special energy called qi circulates in our body. And from Chinese point of view, that energy could be blocked. So when that energy is stagnant, and the blood is stagnant, because qi is the mother of blood, so energy moves and blood moves. But we have toxins in our system too, and very often these toxins I've seen as mucus accumulation. So when the energy and blood and toxins all blocked, patient develop, from Chinese point of view, cancer. Now, we also paying a huge attention to blocked emotions. About 4,000 years ago, in one of the very first books on Chinese medicine, when they even didn't know what cancer was all about, there were notes in the textbooks that when the woman is angry, frustrated with her husband or her sister-in-law or her mother-in-law, she will develop a stone in her breast. And if she will not resolve her issues with her mother or husband or mother-in-law or sister-in-law, that stone will grow and she eventually will die. So that is how 3,000-4,000 years ago, Chinese doctors connected the emotions of a woman with a breast cancer. And there are a lot of research right now which connect stress and emotions. Then we're talking right now about internal factors. There are outside factors. And you know that we're breathing not with the pure air these days. Nobody exactly know why cancer happening. Smoking is a huge part of it. The food, which is chemically treated and not organic and has pesticides, American Cancer Association connects that. And again, emotions which come from outside. Stress, constant stress could also trigger it. Now, what is COVID from China's point of view? Now, it is also a very new concept. And of course, we didn't know about COVID 3,000 or 4,000 years ago. However, Chinese doctors have a great experience of treating different epidemics. And you probably remember that it was a cholera, and it was a plague, and it was Spanish flu. And Chinese doctors always had some kind of solutions for treating it. And from China's point of view, COVID is also has pathological nature, like again, damp and heat and toxins. However, there is a deficiency here. Patient is usually depleted in energy. However, stasis is also present. And on the first stages of COVID, when we were dealing with Delta, they divided into 5 different phases. Every time new variant of COVID comes along, there is a new presentation, basically. But what I want to share with you that when COVID just started, because now after 2 years of dealing with COVID patients, we collected a lot of information about what's going on with our patients and how to help them with Chinese help. So right in the beginning of COVID, when in the United States, it wasn't announced yet that we are in the middle of pandemic, I had 3 patients who came from Europe. And I had no idea that they had COVID. At that point, we knew only that COVID existed in China and Lake Como. My patients came from England. And they came with what I thought was a very severe flu because they had high fever, they had cough, they had sore throat, difficulty breathing, shortness of breath. I was not wearing a mask. I was not wearing scrubs. I didn't have gloves. I was totally unprotected. And I've seen them 4 days out of 5 days I'm in the office, all 3 people. And the only protection I normally take when I see patients with cold or flu, I'm taking classical Chinese formula for cold, Zhonggan Ling. It's so basic, so classical. Whenever we have a patient who comes with those symptoms, immediately Ron and I and everybody else in the office take Zonganling. That is our personal way of protecting it. That's the Zonganling formula, and I'm going to talk about it later on. And on miracle, after being 4 days in a closest contact with these 3 patients who, and you know, when I see a patient, I'm checking tongue, I'm checking pulse, so they literally cough in my face. I didn't have the shield, I didn't have the mask, and I didn't get sick. And then 2 months later, when they came in, they said, Dr. Postolov, did we infect you? We really didn't know that we had COVID. And I said, no, I actually never got sick. So this is a perfect example how, I'm not saying that Zonganling will protect everyone from COVID. And if you take Zonganling, you can walk around, get in contact with patients with COVID, not wearing the masks. It's not at all what I'm saying. I am for all the protection in the world, and I will talk about it. And maybe I was lucky, maybe my immune system was strong, but I really feel that the fact that I was taking Chinese herbs at that point helped me not to get sick. Now, a few words about how acupuncture works from Chinese point of view. So again, we do believe that our body has not only endocrine system and blood system and system of lymph and breathing. We also have the system of channels and meridians where special energy called qi circulates. And when we insert very tiny small needles, they usually vary in the size, and you hardly probably will see them on the screen. That's how small they are. I don't know if you can really see my needle. It's almost like a hair. Patients normally don't have pain when we insert these needles. They may have a little sensation of qi, what we call, it's like little electrical warm sensation, but no excruciating pain. So when people have too much, not enough, blocked, not balanced energy, we put the needles, and we have over 1,500 points in our body. And on the top of it, we have extra points, and we also have points in the ear. Now, of course, Western medical doctors do not believe in this energy because up to this day, we really didn't find a way to measure this energy. However, major institutes, major hospitals and universities did research, and what they discovered, and that was research with the eyesight. When they would do certain points, let's say on the toe, the area in the brain would be activated. And then they would take a control group of patients without acupuncture and just irritate the eye with the light. And the same area which was responsible for the eyesight would be activated. So they realized there is a connection between the point on the body and the brain of a patient. And then they started doing more research, and they realized that at the moment when we insert the needle in human body, there is a chain reaction between the skin to muscles to spine to hypothalamus to thalamus and back. And that's how it was proven that acupuncture is actually having some kind of a mechanism which allows our brain to release very important chemicals. We call them endorphins, serotonin, and many different others. That's why acupuncture is so helpful for menopause, for sexual problems, and for others. Now, National Institute of Health in 1998 released the consensus, which officially proved that acupuncture can be helpful for patients with chemotherapy, nausea, vomiting, pain, and in rehabilitation period. Now, what exactly acupuncture can help to cancer patients? Most of you know that people who go through chemotherapy will have a lot of symptoms of central nervous system, like toxicity, like insomnia, fatigue, mood disorder, feeling loss of control, loss of appetite, weakened immune system, alopecia. Although now there are cool caps which can protect your hair from falling out, but it is not a very pleasant procedure. A lot of my patients decide not to do it, especially people who have gray hair, because even if the hair continue growing, but you cannot color them, the look is not necessarily better than wearing a wig. So we can help basically with most of the side effects of chemotherapy and radiation by doing acupuncture and by giving our patients different herbs. What is interesting to mention, we all are living in society where we all are very kind of goal-oriented. We're all trying to do more and to succeed and to be in a like very vibrant state. And I hear sometimes my patient telling me, you know, I was so tired after my chemo yesterday that I spent the whole day in bed because I was tired. And I have the right to be in bed because I have cancer. And I usually tell my patients, you don't have to have cancer to be tired or feel that you need like excuse to be tired or to spend your day in bed. We really have to learn how to take care of ourselves, especially in the last 2 years where our adrenal gland, and you probably heard it for 1,000 times by now, that we're all experiencing COVID fatigue because our system of fight and flight, which is supposed to be stimulated only in the moments of extreme stress, is actually stimulated for 2 years in a row because we are constantly feeling that we're in danger. A lot of people constantly feeling frightened and threatened, and there are a lot of adrenaline rush, which not supposed to be in our system all the time. So it is okay to feel tired from having a cancer treatment or from being COVID fatigue. A lot of people experiencing that. So please respect your body, respect how you feel. If you feel tired, by all means, lie down and relax. Take time to do something you love to do something for yourself. For somebody, it's being with your grandchild. For somebody, it is maybe doing some sketches or listening to music or playing music. We all have our different levels of comfort, but please take care of yourself. Don't feel that succeeding and constantly being on the top of the game is really what makes us happy. Now, there are other clinical issues which a lot of my patients are facing while they're going through chemotherapy. There are a lot of cancer right now among young people, and very often cancer will leave male or female patient infertile because of chemotherapy. So for men, definitely one of the options is to freeze their semen before they do chemotherapy or radiation, or to wait for 2-3 years and then try to conceive. For women, very often they do get into artificial menopause, but very often in a couple years, their ovaries again will start functioning if they're working with acupuncturists. I want to give you an example. I had a 29-year-old female patient who was diagnosed with cancer on her honeymoon by her husband. And she came to me absolutely devastated. And we went through surgery and chemo and radiation and surgery on plastic surgery. So it was a lot of work. And then a couple of years later, and I would continue. I usually continue treating my cancer patients in the time of chemo very intensely, the week of chemo probably once or twice a week, and then when they're done, maybe once a month. So I've seen her for a year, and then I didn't see her the whole year. And Juan tells me one day that such and such was calling you, and said, oh my God, sometimes when cancer patients forget about you, it's good news or bad news. But I really don't like phone calls when they tell me that cancer is back. But to my pleasant surprise, that patient called when I called her in the end of the day, because I really couldn't handle it in the middle of my day if it would be a bad news. She told me, Dr. Postolov, do you treat morning sickness? So she did get pregnant after having the full course of chemo, radiation, and other procedures. And right now she has 3 children and she's cancer-free. Now, post-operative pain is very important. And I encourage everybody, if you're having a surgery, to get acupuncturist coming to your post-operating room in your intensive care unit, because we have privileges to do it, at least in Cedars we do, because the amount of opioids you will have to take will significantly be dropped. I don't know how many of you are watching. It's a fantastic, I'm really enjoying that show right now. It's on Hulu channel called Dope Sick, about how the whole Oxycontin epidemic started in our country and what kind of horrible things FDA and pharmaceutical company did to create so many addicts in our country. So acupuncture is a natural pain healing mechanism. We're not putting any chemicals in your body. We're making your own brain release endorphins, which are similar to morphine, but it is your own chemical which deals with your own pain. How wonderful is that? We clean liver toxicity. A lot of patients have neuropathy, by the way, who go through chemotherapy. Acupuncture is incredibly helpful for that. Another thing which I recommend all my patients, and it's not expensive, there are infrared lamps which you use. In my office, I have 2 infrared lamps in every single office, in every single treatment room. But you can have a small infrared lamp and half-hour a day, no more, applied on your feet or hands wherever you have neuropathy, and be really helped with that. So acupuncture also and Chinese medicine in general will help you with emotional health and with anxiety. I'm a huge fan of meditation. I start my patients on meditation 30 years ago and released my own CD because my patients want it. But right now, you have so many different wonderful apps. My personal favorite is Insight Timer, where you can enter all information about you, and you're gonna have tailored meditation for your mood, for your condition, for everything. Exercise, all of you probably know, is very important. I do believe that you need to visit acupuncturist on the regular basis, take Chinese herbs, keep a journal, stay in touch with your loved ones. If anything COVID taught us, I believe that it taught us how it is important to use your support system. Now, I'm a big believer in CBD oils. There are a lot of debates right now about it. It is legal in most states in the United States. On a federal level, it's somewhere available, somewhere not. And I'm coming from a very conservative family. A lot of people I know of my age tried to smoke marijuana when they were in college. I never did. And I was always against all sorts of drugs, but I learned really like CBD. So I came from what I call cannabis shy and cannabis scared to be cannabis enthusiastic. However, saying that, I'm using only CBD with less than 0.3% of THC, because the point is not to get high. The point is to activate cannabinoid system A and B and to deal with pain, nervous reaction, and anxiety. So, and you know who taught me that? My cancer patients, because they came to me asking me, what kind of cannabis should we use? And I totally didn't know the answer. And I hate when I don't know the answer, but I'm honest about it. And I told them, I don't know anything about it. Let me learn. And did I learn? Yes, I attended every single seminar designed for medical doctors. And I did a lot of classes before I learned how to use CBD. It's not for everybody, not always safe, but it has a huge help for patients with pain. Now, not every doctor who claims that he is alternative health practitioner is safe. So not everybody who say they cure cancer, actually nobody who says that they cure cancer is somebody I would trust, to be honest with you, because even Western medical doctors will never tell you that they cure cancer. So we have to be very, very selective about our practitioners. And especially now in the time of COVID. And I'm gonna tell you what are requirements when you're looking for acupuncturist. First of all, and that is must, the acupuncturist has to be has to have the license, state license, if we're living in California. I prefer acupuncturists to have state license and national license on the top of it, because national board is different than state board. It requires different set of knowledge. And lately, we start having doctoral degrees available for acupuncturists. So there could be two different varieties. It could be a medical doctor who took a very short course, like 2, 3, 6 weeks in the hospital and calls himself medical acupuncturist. But there is a doctor of Chinese medicine. This is the people who did 4 years of Chinese medical school, 800 patients, fellowship, and then decided to do another 2-year program. And that is a doctoral degree for Chinese acupuncturist and Chinese medical doctor. It's nice when acupuncturist has some kind of medical training in the hospital setting, or if it's a nurse, or of course, you're very lucky if it's a doctor. Communication skills and chemistry between doctor and patient is very, very important. So if for some reason you walked in the office and you didn't like the atmosphere, you didn't like how the doctor treated you, trust your instinct, because we all have that mechanism within us, that detector of lie. And if you don't have a good skills, because having a doctor is almost like having a marriage, it's a relationship. You're sharing with this doctor your most sacred thoughts and pain. So make sure that you really have the chemistry. Now, what is super important in the time of COVID, that the acupuncturist is practicing everything according to the COVID requirement. So every single acupuncturist should wear N95 mask. We should wear the screen shield. I bought myself 7 different colors of scrubs, so I don't feel bored, and I'm changing them all the time, and definitely gloves. This is the must. So we don't spread COVID, because although we do screen our patients, but it is not enough. We have to be protected. So we don't spread COVID between patient to patient. Everything in the rooms should be disposal. We're using disposal needles for many years. It's the law, but I'm not using my fancy linen robes anymore or linens. Everything has to be thrown away after every single patient. Every single surface in my office, I got rid of my art pieces and everything else, has to be wiped with Clorox or Lysol after every patient. I'm scheduling the patients where they never meet each other in the front office. We're spacing patients in terms how we schedule them, because we need extra time to wash our hands, to wipe all the surfaces. So that is extremely important for cancer patients who already come with depleted immune system. Now, this is a huge part, and I do usually separate lecture on Let's Food Be Your Medicine. I do believe that food should be organic. I do believe that food should match your type of the cancer, and in what stage of the cancer you are, if it's before the surgery, or if after the surgery, or it's during chemo or after chemotherapy, if it's at any different stage when you're in remission. I don't have enough time. I see my time is running up very quickly, and I still want to give you a couple techniques for acupressure, but you all are welcome. You can call Ron, email him. My information will be here, and he's gonna send you the power presentation slides, or actually on my website, there is the whole pamphlet, Food as a Medicine for Cancer Patients. Now, what we need to do during chemotherapy to improve your blood count and to reduce the risk of leukopenia. Your red blood cells, your white blood cells usually dropping at the time of chemotherapy. So it's very simple. You put just 4 fingers above, as you see it on this picture, your medial malleolus. And the point is just 1 finger to the side. If you massage at this point 3-5 days, your blood count will significantly improve. However, if you want a really good change, you need to see acupuncturist. There are points on your back which are really building your blood count. And I love that special treatment. So these are 3 points which will deal also with most common problems, both in chemo, radiation, and during the COVID. So if you have nausea at the time of chemotherapy, it's very simple. You take literally 3 fingers from this area where you bend your wrist, and you're gonna feel here like 2 guitar strings. So if you're gonna if you're gonna massage that point, again, in clockwise or counterclockwise for a few minutes, nausea should go away. And that is this picture here. So pericardium 6. Now, one of the best points to build your immune system is stomach 36. Oh, I did something wrong. I shouldn't click here. So this point is located, again, 4 fingers below your knee cap and on the lateral side. So this is the point called stomach 36. In China, they stimulate this point all the time to build the immune system. And if you're feeling like you are completely lacking the energy, you collapsed, it is the kidney 1. It's on the sole of your foot. I have a hard time with my pointer here. So press that point really, really hard. And you see there is like red skin and white skin. And where both of those skins connect, that's where kidney 1. I had several patients in coma who I was able to get out of coma with this point. This is the formulas chemo support and radio support. I use these formulas for 25 years, and I love what they do for cancer patients. In the beginning of COVID, Chinese doctors in Chinese journals published this formula because that was their COVID soup, so to speak. United States was the only country who didn't buy the patent for this formula. What I personally did right when it happened, I just copied that formula from Chinese journal. I had to do my own prescription of the dosage because they didn't publish that. That was patent material. But I just did it according to classical Chinese medicine. And every patient, unfortunately, who did get COVID, used that formula. Nobody ended up in the hospital. Nobody ended up with respirator. And now this formula is FDA approved to be in clinical trial in UCLA and USC. Now, this is the page with my information. You can do screenshot of it. So it's lucypostolov@gmail.com. There are a lot of information on my website. I do have Instagram account where I also share a lot of information about my patients. And if you have any questions, call me, call Ron. We're very good about answering emails and about answering phone calls. If we're not available, we're gonna get back to you. You're welcome to have the copy of my power presentation. I don't have any secrets. I am very happy to help all of you. And I'm so excited that Chinese medicine becomes more and more available to our patients. And I want to finish my presentation with my favorite expression that in the battle with the disease, there are three warriors. It's a patient, it is a doctor, and it is a disease. So you as a patient should be always on the side of the doctor, and then disease will be conquered. I do believe that cancer, when it is diagnosed on time, could be treated to remission, and I'm thrilled and happy to help all of you. Now, if you have questions, let's invite Larissa, because she's gonna read the questions. I know I used more time. I'm sorry.
That's okay. It was wonderful, great information. Thank you
Thank
so
you.
much for sharing it. That was really a lot of information in such a short period of time. And I have entered Dr. Postolov's contact information in the chat room for those of you, if in case you didn't get it in time with the slide that she put up, you can always click the live link there as well. So please check the chat feature. But I'd love to jump into some of our questions here. If you have any questions, please feel free to put them into the Q&A. As Dr. Postolov shared, she will be sharing her PowerPoint. You can either email info@cancersupportla.org for those slides, or you can email Dr. Postolov herself. I will also type in the info@cancersupportla, so you have that email as well. Okay, and this webinar, so sorry for the dog in the background, one moment.
We love dogs. They're our best friends, especially now at the time of COVID. They're very healing. I had dogs who were so healing.
He is very in tune to my emotions, so he's wonderful to have. He's the best coworker I've ever had. Sorry,
I know.
my team, but it's the truth. All right, well, I will jump into some of the questions here. Okay, the first question we have, I'm sorry if I read this wrong. How does acupuncture plus twina massage, I'm not sure what that says, impact results? How often should those treatments be done? Is there a downside to either?
Okay, so basically, Tuinai massage is a special Chinese massage. In general, I am kind of careful with massages for patients with cancer, especially if it is metastatic cancer, because you don't want to spread it through the lymph node system. So when you're choosing your specialist, make sure that they are specially trained for massage with cancer, Tuinai massage with cancer patients. Like I had a lot of special training to work with cancer patients, because not every acupuncturist can treat cancer, or treat is the wrong word, work with cancer. Because with cancer patients, we are very often using what is called extraordinary meridians or like special combination. The goal, never go at the side of the tumor, like if it's a lung cancer, don't go ever to the chest. If it's breast cancer, no go to the chest, go only to distal points. So make sure that, yes, you can combine it, but the Tuinai doctor and acupuncturist both should be specifically trained to treat cancer patients.
Thank you. That's a wonderful distinction to make. Thank you so much for that. Okay, our next question is, what is the name of the Chinese herb that you take?
So for prevention, I'm taking Zonganling. I don't think you can buy it on the internet, or at least on the internet, you cannot buy this brand, because with Chinese herbs, it's very important to have a good company. And I'll tell you why, because not every Chinese herbal company will be tested by third independent party. And it's not only about Chinese herbs. The same comes with CBD products. Like, I would not use CBD product if that company does not provide me with a third party independent report. Because you want to make sure there is no salmonella, there is no E. coli, there is no heavy metal, that it is organic. Chinese herbs, very rare you can find organic, but CBD, absolutely yes. Because it's a lot of it which is grown in the United States organically. So yes, you can buy this formula on internet, but not by the same company. So I would tell you, buy it from your doctor. The one you can buy in Chinatown or in Whole Foods will not be as pure and potent as the one you can buy from your doctor.
Thank you, Dr. Postolov. Do you mind spelling that medication? It's a bit hard to see the label from here. I will type it into our Q&A here.
Yeah, here.
Okay.
Can you see it?
Yes, I can. Thank
Zonganling.
Wonderful. Thank you so much. Okay.
So I take this formula. If patient comes in who coughing, sneezing, I take that formula always when I'm flying an airplane, day before, day of, and day after. Even before COVID, because the filters in airplanes are not clean. So this is my formula when I travel, when I have a patient who is sneezing or coughing, where any member of my family is sick, I'm just taking this formula for prevention. It's not a formula which you take when you have COVID. If you have a COVID, it's a different formula.
Okay, thank you for that distinction. Okay, the next question we have is, are there any web resources or books that you trust that you would recommend to learn more about acupressure? This person says they've been having good luck with acupressure bracelets on P6 for nausea, and they would like to learn more.
There are so many good books on acupressure. I cannot give it to you right now from the top of my head. To be honest with you, because I studied acupuncture and acupressure was just a course along the way. But if everybody have an interest, I probably could do a special lecture on acupressure, and there I would share sources.
Wonderful. Okay, thank you. Our next question, how often do you recommend acupuncture for neuropathy and to prevent recurrence post-treatment?
Yeah, for neuropathy, I would say at least once or twice a week, and every day to do infrared light for 30 minutes. And then, and again, usually neuropathy starts with chemo, so start it while you're having chemo and do it until symptoms are gone. And when you have improvement, then you don't have to do once or twice a week. You basically can do it once a month.
All right, thank you. Our next question is about yoga. They're asking that since yoga also moves things around in the lymph system, is it possibly dangerous for breast cancer?
Well, yoga has to be done by a very, very good yoga master. And I would definitely check the credentials of a yoga master who is doing with you, working with you, because classically you become a yoga master after 7 years of training, 7 years. Most people in United States becoming the teachers and instructors of yoga after, I think, like 2 or 3 months course. So I don't believe that they are really yoga masters or yoga teachers. And yoga master would never put you in any position before you would learn truly how to breathe and how to meditate. How many yoga masters do you really know who starts with breathing and meditation? Almost none. They immediately want you to start doing positions and turn into pretzel. Being a yoga master is probably as difficult as being a doctor of Chinese medicine. They're very highly educated and trained people. So unless you are positive that your yoga master is a true master, I wouldn't even start working with them. I see so many injuries from yoga. I'm a big fan of yoga. I am a big fan of Tai Chi and Qigong, which I even didn't have time to talk about today, but it has to be the right master.
Okay, thank you for that, Dr. Postolov. I'd like to add that here at CSCLA, we do have Qigong and yoga classes. They are all licensed facilitators who've been doing it for a very long time. A lot of them have specialties working with oncology patients, making sure that they're taking things slow, moderated movements, things of that nature. If you're interested in learning more, feel free to reach out.
Yeah, I trust people who work in cancer support community. They're very picky about who they choose. Yeah.
We certainly are. Thank you.
Yeah,
For that.
I know that.
Okay, someone is asking, is self-massage helpful?
Yeah, certain types of self-massage, especially acupressure, is helpful for sure. And certain points like stimulating your immune system is very good. I love massaging the head when you wash your hair because we have a lot of stagnant energy in this area. If you don't have spreads, I like massaging the breast, under armpits, massaging along the channels. I'm a big supporter of self-massage, but again, if you don't have spreads, because moving the energy is so important.
Wonderful. All right, thank you. I'd love to learn more about self-massage. That sounds wonderful. Okay. Someone has asked, what are the approaches for the chronic strain on the caregiver to a cancer patient?
Oh, that is a very important question because I've been on another side of a table, like a caregiver when my mom had cancer and when my husband was cancer. And the thing is, when we love somebody, it is so easy to give all our energy, all our love to the person who is suffering. And to be honest with you, I'm not very good about self-protection in this case and self-care because you get so immersed with this person who you love and you would give anything to protect and save that person, and you drain yourself. If normally I'm measuring like energy from on a scale from 1 to 10, where 1 is low and 10 is high, when my husband passed away, I was in -5. Literally, I was so drained. And I knew what I'm doing. I did it totally consciously because I just really want to help him to survive. We tried everything in the world, but he had a very rare type of cancer. From the day he was diagnosed to the day he passed away was 4.5 months. It was unknown primary, low differentiated cells, very quick metastatic, and nothing could be done. But of course, I tried everything. My mom lived with stage 4, 4.5 years, but in both cases, I was very drained. So I wish all of caregivers were able to take time for themselves, to recharge, to recuperate, take baths with Epsom salts, do some meditation, have somebody else to help you. There are a lot of people who have children, we have grandchildren, we have siblings, we have people we can hire, but have some time for yourself. Because sometimes I see the caregiver dying before the cancer patient from heart attack or from something else. So for all caregivers out there, please take care of yourself, because if you're not taking care of yourself, you cannot help the one you love.
I think that's so incredibly important. Self-care for each one of us, whether you're a patient or a caregiver, make time for yourself. Absolutely. And we do also have some wonderful caregiver support if you're looking for some extra support.
Yeah, Cancer Support Community, I mean, the whole name of it, you guys are pros in supporting not only cancer patients, but caregivers. You have special classes, you have special groups for parents of cancer patients, for children of cancer, for spouses. I think it's so important to have that support system.
Absolutely. Yeah. Thank you. That's a great summary of our services. All right. And
well, I am on board with Cancer Support Community probably for 25 years. So I'm not only member of your group, but your biggest supporter. And I do my lectures voluntarily for years with you.
Well, we have loved our partnership. So thank you, Dr. Postolov. Maybe one day we'll be able to host you in person again.
Well, I hope so. I really love speaking face to face. I'm such a person of energy to hug, to put the point, to really do everything in real life. It's so hard to speak to empty screen.
Yeah, absolutely. Well, that's all the time we have for today. Thank you so much, Dr. Postolov. I know that we've had quite a bit of questions. If your question wasn't answered, please feel free to send Dr. Postolov an email. Again, her email is lucypostolov@gmail.com. I'm sure she'd be happy to answer some of your questions.
I will be. I see there are 9 questions which we didn't answer, but please email me. I'm going to be thrilled and happy to answer all your questions with email, in person, on the phone, any way I can help. That's truly the mission of my life.
Thank you. Thank you. And thank you for all of this. And we hope to host you again soon.
Okay, we'll be happy to.
Take care.
Bye-bye. Thank you, Larissa. Thank you, everybody. Stay well.